Welcome to State of the State. As part of our celebration of Mental Health Month, we're here today to talk about Youth Mobile Crisis Services, what they are, what difference they make, and what we need to do to sustain them. I'm Susan Orban, Director of the Washington County Coalition for Children, a regional child advocacy organization in Southern Rhode Island. And I'm honored to be your guest for today's show. We're pleased to have two Rhode Island leaders of youth mental health crisis services with us. Beth Bixby, Chief Executive Officer of Tides Family Services, and Sarah Kelly-Palmer, Director of Behavioral Health at Family Service of Rhode Island. Both guests have long and distinguished careers as both clinicians and administrators of children's behavioral health services in Rhode Island, including Youth Mobile Crisis Services, and we're honored to have you both here today. Welcome.
Thank you, Susan. Thank you.
Sure. So before we begin diving into our discussion about Youth Mobile Crisis Services, can you tell us a little bit more about the agencies you work for and the services that you provide to children and families in Rhode Island? Do you mind starting, Beth?
Sure. I'm Beth Bixby. I'm the CEO at Tides Family Services. As you mentioned, I am a clinician as well. I started at Tides, be in my 24th year.
Wow.
As a clinician. The work that we do at Tides is all home and community based. We have an array of programming that is prevention, and we also have very intensive home-based services where we are at the homes, daily, sometimes more than that. Everything we do is working with the family. We take a family approach as well, and a very holistic approach, and really entrenched in the community. So we have 6 sites across the state, and they're strategically located in the communities where we serve the population. And we have about 3 target populations: children's behavioral health, also juvenile justice. We have the only reentry program in the state, and then we also have a lot of child welfare, home preservation services. And within that, we have evidence-based programming, and everything is through a best practice standard.
So Youth Mobile Crisis Services are well in your wheelhouse.
Yes.
Yes, indeed. And so, Sarah, tell us about the services at Family Service of Rhode Island.
Sure. So Family Service of Rhode Island has been around, I think, since 1892.
Wow.
So a really long time. I've been there for 21 years. Mm-hmm. Started off as a clinician in our home-based department and have had several roles since then. And we offer a wide variety of services under our 4-H divisions, we call them: health, healing, hope, and home. Mm-hmm. So like Tides Family Service, we do a lot of child welfare programming, behavioral health for children and adults, as well as early childhood programming. We do AIDS case management services, a real big continuum of both social service and behavioral health programs throughout the state of Rhode Island.
So there's no question that your agencies both are dedicated to serving vulnerable families, and Youth Mobile Crisis Services are no different. So with that as background, let's talk about what Youth Mobile Crisis Services really are. How do they work? And when they are available. So I don't know who wants to dive in first. Sure. Beth, why don't you start?
Tides Family Services and Family Service of Rhode Island are the 2 primary providers of mobile response stabilization services, and it was a natural fit for both organizations. As you heard, we are both embedded into the community, and everything we do is through a family lens and in the home and in the community. So a lot of the work that we were already doing had some similarities to what mobile response and stabilization services are. So we get phone calls from parents, schools, pediatrician offices, and sometimes it's just word of mouth of folks that have learned about the service. And everything that we do is really trying to avoid hospital and police intervention, and really in the least restrictive environment. So we will respond within an hour to wherever the phone call is placed from, and we have a screening process, the phone is answered by a licensed clinician, and a licensed clinician responds to the crisis. And it's usually defined by the family of what the crisis is, and that's along the best practice standards from SAMHSA.
That's wonderful. Are there differences between the services, between the two agencies?
So we've worked really hard to partner with each other to make sure that the service that we're providing to children, youth, and families is the same high quality, whether you're calling Family Service of Rhode Island or TIDES Family Services. So the model that we're implementing is based on an evidence-based best practice model. So that means that we have standards that we follow and have to have fidelity to that model. So, we both have teams of 2. No one ever goes out alone, so there's always a licensed clinician, as well as paired with either a case manager or a peer support specialist to respond to the child and family.
And when you talk about clinician, what kind of credentials are you talking about?
Sure. So those are master's level clinicians who have completed their master's in degrees like social work or mental health counseling, so that they're qualified to respond and intervene in a behavioral health crisis.
Excellent.
Yeah.
And how are the cases assigned?
Yeah, so I can jump in there, Beth. So basically, like Beth said, both agencies respond within an hour to request of service. So during our kind of regular business hours, our mobile crisis team, they work a little different hours, right? Usually 10 to 7 or a little later in the evening. And so whoever's available responds right away with that pair, because we want to get to children and families when the crisis is happening, because that's when they need the help. And we're able to respond 24/7, so we have staff who are also on call overnight, weekends or holidays, the same at TIDES, where you get that call, you do the screening, triage, and you respond right away. So,
and as Sarah said, responding while the crisis is happening is really critical, and it's been very successful because we are responding as it's happening. Quite often a referral would come in and the crisis had, it's been a couple days, and so the family isn't at the height of the crisis, and at times more likely to drop out of service. So I know that one challenge was where families would end up at the ER and they'd spend hours there, and then they would get discharged with a referral for a week out. And so what's unique about this service is we respond immediately, and then we stay with that family for 30 days until we are able to link them with an aftercare service. So the typical years ago, the crisis would be screened on the phone, and then you would be told to go to an ER if it was hit a certain threshold, and then you would get a referral for a week out. And so the more immediate response has proven outcomes to be really effective, and the experience overall from families has been very positive.
That's great. So tell me what the services look like. So do you arrive in a van that says Family Service of Rhode Island or TIDES Family Services? Does it look like an EMS or?
No, and so our workers arrive together, yes, but it's in just a typical car or whatever their transportation is that day. And it's important that we do that in a way that kind of reduces the stigma of what's going on with that child or family. So, as Beth said earlier, we often respond to schools, or we might be responding to a child's home. So our team arrives and you wouldn't really know who they are. It could be a friend visiting your family. So I think that's really important because typically when children would be in behavioral health crisis, let's say at a school, oftentimes either an ambulance or police would be called, and that could be really disruptive, not only for that child, but for really the entire school. So calling our teams means that it's a little more discreet, and it doesn't escalate things or kind of cause
It's more a natural response in a natural environment, where it's more of a caring approach, because quite often when, you know, law enforcement is called, sometimes that escalates behavior and can have a negative outcome when the intention was very different. And so we don't want to pathologize any sort of behaviors and avoid unintended consequences. And I think it's really critical with decriminalizing behavioral health. As Sarah had said, there's a stigma, but oftentimes, you know, kids who act out could be interpreted differently, and we want to avoid that at all costs so we can work through those challenges.
Right, absolutely. And it's really, in many ways, no fault of the first responders that have often been called. It's been by default that they have been called because we haven't had the kind of behavioral health support services that communities have needed. And so the only response that is available to everyone for free 24/7 is 911. And so what many behavioral health programs and providers have done over the years is make that very well known. Even when you call for an appointment and you get an answering machine, the answering machine says, if you are in crisis, call 911 or go to your local emergency room for services. And that is not the place to handle a crisis. In the midst of all of these other crises that are happening in an emergency room, and especially for a child, in that kind of bright light, chaotic environment where someone might be having a heart attack in the next room and so forth. Can you speak a little to that, Sarah?
Sure. I think we want to change that, right? So instead of having that message say, if it's an emergency, call 911, we would love to have our mobile crisis numbers be that option, because I think that, you know, not only is it a cost-effective way to intervene, you know, we just went through a pandemic, and if you think back to the emergency rooms being flooded because of COVID-19, you know, being able to divert kids in behavioral health crisis to a service that really matches what they need frees up those emergency departments to be able to tend to the heart attacks or those medical emergencies, why they're really set up. And our programs combined, we have a 92% success rate of diverting kids from either that emergency department or having law enforcement called. So it's a really
amazing
successful program.
Absolutely amazing.
Yes.
Very few programs, and you can chime in here, Beth, as well, have a 92% success rate.
It's huge. And, you know, Susan, you and I had talked about an article that was in the Providence Journal from 2005 that talked about the challenges that we had with kids being boarded at the hospital. And when we started the program, it was during the time where RSV was at an all-time high, and local hospitals within the New England area were full. And a lot of the beds, the medical beds, were taken up by psychiatric patients. And now there's less visits to even the emergency department, but we don't have kids boarded either. And one thing that we were also finding was when we first started the program, a lot of the families that we were seeing, it was the first time they had any sort of behavioral health intervention because of the capacity issues and access issues that we have. So that's been, you know, really effective with the 92% success rate of diverting kids from inpatient hospitalizations, but we are also able to link them with service and get to kids a lot sooner. So then challenges are escalating, and families, have a roadmap of how to manage some of these behavioral health challenges, because mental illness is a lifelong journey, and so the earlier it's treated, the lifelong trajectory for that young person can be dramatically different.
No question about it. I guess two things come to mind also. And you're talking about the success of the program. One is how much money is being saved by children not being cared for in an emergency room, which is a much more intensive, expensive intervention. And also that component that you provide in terms of stabilization for 30 days. So when someone is discharged, typically from the hospital, they may be given a list of numbers to contact, and they may or may not be right fits with their insurance, and so it can be quite a while before they find a provider, as opposed to someone showing up within an hour, and then that same team providing stabilization services for 30 days until you make sure that there's a connection to another provider. Just really amazing work, and it's no wonder that there's a 92% success rate with that level of service. So can you give me an example of what success looks like for a family? Can you share a patient example?
Sure. Do you
want to?
Sure.
Yeah, sure.
Yes, please do.
Many examples.
Yes.
But, so I'll share one story of, it was a 12-year-old student who came to us because the school called her mom, a single mom, and said, okay, your daughter has expressed some suicidal ideation. She is threatening to harm herself. We can either call the ambulance or we can call Children's Mobile Crisis. So the mom elected to have them call us. And this 12-year-old had never had a mental health emergency, had never had therapy before, but she deals with a chronic medical condition and has been having a real hard time this past school year with peers, with her chronic medical condition, and so presented to us because she had expressed a suicidal ideation. We were able to respond right away to the school and made a plan and a safety plan, engaged with this 12-year-old, and then we were there out at her home the next day, meeting with her and her entire family. And what the mom has shared with our team is that not only were we able to stabilize her daughter and give her daughter that hope and work through this by hooking her up with a counselor that she's clicked with and she's really thriving now, but our team was able to support this mom who did not know how to respond to her daughter, who was feeling this overwhelm of depression, who was having suicidal ideation paired with all these peer problems. So not only, was the mom grateful that her daughter was feeling better and had the services, but for her, having our team be able to give her that psychoeducation about, so here's what this means, and here's some words you can use to help respond to your daughter, and this is what it means to safety plan, and you can call us 24/7 if you have a question. I think that is what made all the difference in that case, and I think we often forget about the family, right? This is a family issue, and it really warrants a family response.
Right. Children grow up in families.
Yes, and that student is really doing so well now, and continuing in therapy, and it's, so.
Yes, that's excellent.
And I think, just, we have many stories that are very similar, and I just want to share a little, a story about a similar situation, but a mom had reached out and said that, the family had switched schools. They had sent the daughter to a private school. They had done lots of different programs over the years and different providers. And she said it wasn't until they had Children's Mobile Response to come out to the home that they had significant progress. And it was because it's more of a non-traditional approach where we're in the home, we're in the community, we're working with whoever's identified as a natural support, we're working with the school, anyone who's involved in that young person's life we're collaborating with, and typically, that's not what services usually like. It's more of just focused on the identified client and then, incorporates family, but we're taking a whole systemic approach. Anything that has a challenge that's faced with that family. And so the mom had said, for the first time ever, and we've been at this a long time, and she said, we've paid out of pocket anything to help my daughter, and it wasn't until this service came out.
Woohoo! Yes, what success stories for children. That's really wonderful. So mobile crisis services are an important component of the new 988 crisis system that's being implemented nationwide. And the new system involves not only a call to a hotline, someone to call, someone to respond, and then a safe place to be for kids. And for kids, that's definitely at home. And understandably, these services need to look different for adults and children.
Yes.
And so why are youth-specific mobile crisis services needed as a part of this 988 crisis system?
So I'm a mom, right? And my son, when he needs a doctor, he goes to a pediatrician, right? So it's kind of that same concept. So for kids and youth in behavioral health crisis, best practice in our field is that staff who are child confident, that's what we call it, are those that respond to children. What that means is that our staff have training in things like child development, evidence-based practices, clinical interventions that are child-specific, because if I'm responding to a behavioral health crisis of, let's say, a 6-year-old, that's very different than responding to a behavioral health crisis of a 40-year-old, right? Their needs are entirely different. Your approach needs to be different, your intervention needs to be different. So it's really important that our system recognizes that, and that's what part of this program does, is that it requires that the staff going out are child competent.
And the other critical component is ensuring that the family is involved. Yes. With adult services, it's really focused on the individual, and when you're working with a child, you need to focus on the entire family as well as the child.
No question about it. So how do we sustain these services and make them available statewide?
So that's the million-dollar question, Susan. As you know, there's been a lot of advocacy efforts. Right now, the program is funded through a system of care grant through the federal government called the SAMHSA grant, and that grant is slated to end September 30th. So we have been advocating with the Executive Office of Health and Human Services for sustainable funding through different initiatives. One is the Certified Community Behavioral Health Clinics initiative, but there's also different funding mechanisms. At the moment, we've also been advocating to ensure that all kids have access. So the Certified Community Behavioral Health Clinics is just for Medicaid families. So we are also trying to ensure that commercial insurers are also going to reimburse this service, because it's critical, because we're not going to answer the phone and say, what kind of insurance do you have when someone's in a crisis? So it's really important that there's access for all kids and families.
Absolutely. And my understanding is that House Bill 7874, introduced by Representative Tanzi, and Senate Bill 2607, sponsored by Senator DeMario, would require private insurers to cover youth mobile crisis services to help sustain them.
Yes, and both Rep. Tanzi and Senator DeMario have been wonderful champions for us and advocating for that. And I think that's just one piece of the puzzle, Susan. So we need private insurers to recognize and cover the service, but we also need them to reimburse us at a rate that covers the 24/7 services. Because
Yes.
this service is very different than a typical outpatient service, for example, where a client shows up, you have the session, and you bill for that one session. We have to be able to sustain our 24/7 coverage so that we can respond within an hour to children and families in need.
Sure.
And many
that
states-
must be much cheaper than emergency visits and hospitalization for families. And I know that similar legislation has been passed in other states, including California, New Jersey, New York, Utah, Virginia, Washington, West Virginia, and Wyoming. And so as a child advocate, I hope that Rhode Island joins the ranks soon and passes this important legislation. So I feel like we could talk about this topic for a long time. I want to thank you both for a very illuminating discussion. I hope that our presentation helped you understand the lifeline that youth mobile crises provide to children and youth in Rhode Island. But I also want you to repeat, Beth, how families can access the services in a crisis, at least between now and September 30th.
So each organization has a cell phone number that is answered 365 24/7, or also you could go Google it and one of our numbers will come up. But for the TIDES program, it's 615-9374.
Okay, and?
For Family Service of Rhode Island, it's 854-6678. And
Terrific.
families can also call 988,
Yep.
and they can get to us
Yes,
that way as well.
I was just getting to that. So if you or someone you know is in crisis, they can always call 988 24/7, and they can call, text, or chat. The service works much like 911. And another resource, if you're concerned about a child or just need some advice, you can call KidsLink, triage and referral network, at 1-800-855-543-5465. So we've given you lots of phone numbers and resources. Help us help young people in our state by advocating with your local legislators to make sure that youth mobile crisis services are sustained. Thank you so much for joining us tonight at State of the State.